in rural America, you can make a difference. And I think that's exciting in all different areas, including if you're a primary care doc. You might be in many urban settings devalued and everybody's just focusing on the specialists. In primary care docs in rural America, they're doing everything and they're just actively touching, and they are immerses themselves as part of the community. And it's not just the doctors, it's all people in the healthcare arena. You really are a valued part of the community. And that's, I think, is pretty cool.
Hello, everyone. I am very excited because we have a very special guest, Mr. Thomas Campanella. I just want to give you an opportunity to tell us a little bit about yourself and why it's very important for students to kind of know the business side of medicine.
Okay, well, a couple things. First of all, I have worked Erkeda in probably for the last 40 some years in diverse sectors of healthcare. So I've been in the healthcare consulting side. I was a vice president of healthcare finance and care management. So doctors and nurses reported to me at Blue Cross and Blue Shield of Ohio for 13 years. So I had that sort of the payer perspective of healthcare. And then I was, which really is relevant, I was the associate dean of Ohio University's Osteopathic Medical School. And I was over there, both their clinical operations as well as population health and community health. And in that role, I was actively involved with the medical students, and we had a strong focus actually in family medicine, but I also became very familiar with rural healthcare. We came back to Cleveland and we wound up, I started my own healthcare consulting company, all in diverse sectors of healthcare. And then I'm a healthcare attorney. I just recently retired, and I've been executive director, basically, of healthcare graduate programs at Baldwin Wallace University in Cleveland. And probably 20% of our students are physicians. So that's just a little bit about my background.
I love that. And I love that there are so many facets that you have that are connected to medicine, because a lot of our students are pre-meds. And some of them are at that point where they're thinking, like, is medicine for me? Or when they're writing their personal statement, they're sitting there thinking, like, I really want to help people. And I always tell students, and it's kind of weird because this is a podcast like geared towards like pre-meds and medical students, that if there is absolutely anything that you can think about that you would like to do aside from being a physician, try that first. And then if medicine's still on your heart, then come back to it. And there are so many different ways to help people. Like you mentioned, you're a healthcare lawyer, you've been a healthcare executive, and you've managed healthcare in so many different ways and touched so many people's lives. And now you have a very popular blog, as well as many other things that kind of focuses on healthcare. And we'll talk a little bit about that. But I always want to tell students that there are so many different things that you can do in healthcare that's not necessarily just one-on-one patient care.
Correct. I couldn't agree more.
One question that I have for you, since we mentioned your blog, is you have a few very amazing articles focused on rural health. And as you mentioned, you have ties to that realm. And I feel as though we don't talk about rural health enough.
Correct.
What are some challenges that is facing rural health?
Well, first of all, and you really hit it on the head, think about it. When you look at, for an example, the United States, and you carve out the major cities from a population standpoint, most of America is in rural areas. I know, like in the state of Ohio, probably 80 of our 88 counties are rural. And you're right, we sort of neglected rural healthcare. We focus a lot, and rightfully so, on healthcare issues in the big cities. And there are definitely challenges, and we need to continue to direct resources in that arena, but not to the detriment of the rural healthcare arena. And when you think about, the challenges that people face in rural America, it's from so many different perspectives. One, there definitely is a migration of sort of the young, if I want to call it the young people, where they're looking for jobs and jobs are not necessarily getting there in rural America. And so the aging population over 65 in rural America is much greater than any other parts of the United States. So one, you have the elderly. Number two, you have, just by its very nature of rural healthcare, transportation issues. Three, going back to healthcare workers, there is a complete absence in so many different regions of healthcare workers at all levels. And this goes back to what you were saying earlier. If somebody's altruistic out there, in high school, college, even med school, and wants to make a difference, you can make so much more of a difference in rural America in so many different areas. And it's not just in the arena of being a physician, although they definitely need primary care docs, but healthcare workers, physician assistants, nursing, community health workers, all those arenas is definitely needed. One of the other big issues that also, because of COVID, was a big issue from education standpoint too, is the lack of broadband in those regions. So while the rest of America, including the cities, are saying, oh, we're gravitating to virtual healthcare and everything else, in many parts of rural America, they don't have access to broadband, and consequently, they're not even able to get virtual healthcare visits in that. So multiple challenges, and consequently, there needs to be multiple strategy and initiatives to be able to address it.
Absolutely. I couldn't agree more. And I love that you mentioned, like, we need all types of healthcare professionals in rural areas, because a lot of times patients will have to travel multiple hours just to get care. And not only, like, of course, yes, there is a primary care shortage, but we also need some specialists there. We need dermatologists, we need surgeons, and all of those kinds of people as well, so that all of our populations can have a healthier life. And like you also mentioned, there have been some innovations, and a lot of people are moving into the digital world, as we've talked a lot about on this show. But there is a digital divide, and it's not only focused on urban environments and things like that. There's also a digital divide in the rural areas. So we have to come up with some initiatives. Like, we have been trying to work on some expansion of the broadband and things, but there needs to be other initiatives
Agreed.
as well to help improve the rural landscape. You have discussed in the past your thoughts on some community initiatives that can improve rural areas. What are some of those?
Well, first of all, and this is important in every area, I don't care if it's urban or others, is collaboration between the stakeholders. And it's not just the healthcare stakeholders. Obviously, hospitals, physician groups, federally health qualified health centers, others need to be able to work together. But also their Department of Health's areas like Jobs and Family Services, a lot of social service agencies, school systems, and that. All of them need to sort of have a collaborative focus, because it's really, when we say health in rural America or even in urban America, it's more than that. What you're really trying to do is improve their overall quality of life, which obviously health plays a critical role, but there's so many other aspects to it. And obviously you have the mental health side of it all, but you have the financial side, you have, issues as it relates to, overall poverty, but you have issues related to violence and guns and everything else. I mean, there's so many different aspects. So my big recommendation, and I was fortunate enough to be the executive director when I was down in Southeast Ohio with the medical school, of a collaborative that worked on quality of life issues in about a 9-county area, which are some of the poorest counties in the whole country. And the collaboration that occurred between the stakeholders were terrific. We addressed so many different issues, including, and a lot of people say, oh my God, how is this related to health or that? But related to lice in schools. It's something that some of us in suburbia might think, well, that's not a big issue. Well, in so many parts of America, that's one of the leading causes of absenteeism for kids. And then when you talk about education, it has both a direct and indirect impact on their overall health status. So there's different ways. And so we actually work together to come up with a comprehensive program using all the different resources to be able to do it. So that would be my number one recommendation. But we also need to put pressure on both the state and federal government. Even though they have been active in that arena, there needs to be a much more of a strategic focus in regards to rural America. And we need to be able to, there's a lot of rhetoric about in some arenas about addressing it, but we need that action and we need some positive steps. There has been, and I applaud the federal government, they're now saying that they're going to spend billions of dollars over the next 10 years on expanding broadband to specifically rural America. That will be a major, major plus. But we still have all the various transportation issues. We have hospitals closings. We have maternity deserts where the people can't, have a baby delivered, and you got all those transportation and they're not getting the neonatal care they need. So really I think the biggest thing is sort of a collaborative initiative between both people in the community working with people at the state capital level or representatives and working at the federal level on a very focused initiatives. And every area is going to have some different issues. But with that, by the way, going back to the younger people that may be listening to this podcast, just think, if you want to make a difference, and we talk about things like collaborative initiatives or working or data analytics that need to be done. In rural America, you can make a difference. And I think that's exciting in all different areas, including if you're a primary care doc. You might be in many urban settings devalued and everybody's just focusing on the specialists. In primary care docs in rural America, they're doing everything. And they're just actively touching, and they are immerses themselves as part of the community. And it's not just the doctors, it's all people in the healthcare arena. You really are a valued part of the community. And that's, I think, is pretty cool.
Absolutely. And I want to just reiterate 3 of the major key points that you just discussed. Number 1, 80% of your health is affected by things outside of the healthcare system. So all of the things that we love to kind of lump together as the social determinants of health kind of buzzword, but it's real like common sense determinants of health. If you have healthy places to eat and safe neighborhoods and you're not worried about money and all of those kinds of things, you will be healthier. And like you said, we have to put pressure on our legislature to make these rules and things like that because they affect the community. So knowing who you're voting for, especially with this being an election year, because it affects you and your neighborhoods, and it trickles down into all of those things about housing and safety and food deserts and all of the different things. And then on top of that, figuring out different ways to work outside of the box to come together to improve your systems in your neighborhoods. So not only focusing on the healthcare system and how we can interdisciplinarily integrate different things and work together collaboratively, but thinking about collaborating outside of the healthcare system with community centers and different nonprofits and different other things, like even thinking about integrating technology outside of just telehealth, like thinking about things like they're doing with Amazon with drones for medications and trying to eventually get there with food and stuff. So there are so many different opportunities out there. It's just how can you work to impact it and make that difference.
By the way, and one other thing that was, this goes back, I was there in the late 90s, and we actually had and continue to have down there with the medical school mobile health vans. Because of transportation issues, and you're talking about an 8-county area, in pretty much every one of those 8 counties, except for one, Athens County, there's no hospitals and there's little or no doctors. There might be some federally qualified health centers. So you literally have to go out to them. And so we had those. And one of the other areas that they're working on is vitally needed is vans that focus on the dental side. So many of these people in rural America, have issues. There's no dentists available. And so you can imagine, as we go to our every 6-month cleaning, they may be every 6 years being able to go to a dentist.
That is a really great point that you bring up when you're talking about different ways that we can implement different parts of the healthcare system. For example, I had about a year ago, guys, if you look back, I had a physician on here who was talking about how there is a 2-year wait for pediatric patients of dentistry to be able to get procedures that they were needed because there was no anesthesia nearby. So he opened up a mobile health van to help get anesthesiologists out to where they need it. So if we think outside the box, we can definitely expand access to care.
That whole brainstorming concept of getting the right people, it could be in a room, it could be just in various ways, planning or whatever it happens to be. One of the exciting things, and I love that you keep mentioning thinking out of the box, because guess what? The old ways we've been doing things are not working. And so if we want to gravitate from what I call, and a lot of people call, our sick care system to a real health system, we really do need to think out of the box in so many different ways, including how we pay for healthcare too.
Absolutely. Like if we keep doing things the way we've always done, we're going to keep getting the same outcome. So we have to, if we're talking about being in 2024 and having the innovation and wanting change and wanting healthier populations, we have to start doing new things.
Correct.
Speaking of that, we're coming to the close of our discussion, and this was so lovely. I'm going to ask you a question that I love to ask all of my guests because the answers are so unique. We know that the healthcare system isn't perfect. We need some help. If you had a magic wand, what is something that you would change about the U.S. healthcare system?
I wish there was one silver bullet, by the way, to answer that question. The challenge is there isn't just one answer, but I think one of the keys is, I call it a phrase that I've used in my publications. A healthcare system is shaped by what you pay for and how you pay for it. Think about that. So the what you pay for example, if we say we don't have enough preventative care, well, if you don't pay for it, you're not going to get it. So, the common sense aspect of it. But the how you pay for it is key. And right now, what we have is a healthcare system, both that the government through Medicare as well as private payers pay what they call fee for service. And basically, it's the more you do, the more you make. We really, even though they talk about it, we really don't have a payment system that pays for value. We don't have a payment system that really rewards providers and other players that to keep people healthy. And so you're never going to have a health system to address those issues unless you really direct your resources to it. We spend 20% of our gross domestic product on healthcare, and we still are in a position where we don't have a healthy society. And we have so many different diverse issues that are impacting people from different perspectives. We have the power, we have the resources, we just need to do it. That's my story, and I'm going to stick to it.
Absolutely. I love that. We have to put our money where our mouth is. And if we want to prevent and to decrease costs and to do all of the things, then we have to invest in it. So I couldn't agree more. I definitely appreciate you taking the time to share all of your pearls of wisdom with our audience. I want to give you an opportunity to say goodbye and let the audience know where they can find you.
Okay. Well, first of all, here I am. Well, first of all, you can see me on LinkedIn. I have been publishing there for about 6 years on all diverse topics of healthcare. So you have it there, Thomas Campanella. Just plug it into LinkedIn and the healthcare executive in residence there, and you'll see all my publications. And I try to keep it updated every couple of weeks. You can actually email me at TCA, M as in Mary, P as in Paul, at B as in boy, W as in Wally.edu. So it's tcamp@bw.edu. And if you email me, I promise I will email you back directly.
Thank you so much for all of the listeners out there. I love it when someone mentions LinkedIn because y'all know that's my jam. Get on it. It is for healthcare professionals. And even if you're in school now, it's important to start looking and learning and connecting and learning from one another there. And if you have any future suggestions for any potential topics or guests, you can definitely reach out to me on LinkedIn, or you can reach out on my Instagram at Dr. DOCTOR, the letter DGRAM, and we'll get back to you. Have a good day. Bye.
Bye-bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.